Remember Mary? At 65, her diabetes had stolen her joy. Every night, her feet burned like fire, tingling so badly she couldn't sleep. During the day, a constant brain fog made her forget simple things, and she felt perpetually exhausted. Does any of this sound familiar to you? If you or a loved one is living with diabetes, you know the daily struggle. The fatigue, the nerve pain, the memory lapses, feels like a part of you is being taken away, doesn't it? What if I told you there are 4 simple, yet often overlooked vitamins that could help you reclaim your energy, clear your mind, and soothe those stubborn nerve issues? Today, we're diving deep into these essential nutrients. You'll learn exactly why they're so crucial for diabetics, how they work, and how you can start incorporating them safely into your life to potentially transform your daily well-being. Stick around because this information could be a game changer. Hi, I'm Dr. Michael Bennett, a nutritionist and health expert with 20 years of experience focusing on holistic approaches to chronic conditions like diabetes. My passion is empowering you with the knowledge to thrive, not just survive with your health challenges. For years, the focus on diabetes has primarily been on blood sugar control through diet, exercise, and medication, all absolutely vital. But what's often missed is the critical role of specific micronutrients, the vitamins and minerals that act as the unsung heroes of your body. When you have diabetes, your body's ability to absorb or utilize these nutrients can be severely compromised, leading to a cascade of painful and frustrating symptoms. Today, we're cutting through the confusion and bringing you groundbreaking insights into 4 essential vitamins that every diabetic should consider. These aren't magic pills, but powerful allies in protecting your nerves, boosting your energy, and sharpening your mind. If you're ready to take charge of your health, hit that like button, subscribe to our channel for weekly health insights, and don't forget to ring the bell so you never miss a vital update. Managing diabetes is like a complex orchestra. Medication, diet, and exercise are the main instruments, but without the precise tuning of essential vitamins and minerals, the whole performance can fall flat. So, why are diabetics particularly susceptible to vitamin deficiencies? There are several key reasons. Firstly, high blood sugar itself can deplete vital nutrients. It's like your body is constantly running a marathon, burning through its reserves and requiring more of these crucial cofactors to simply keep up. Secondly, many common diabetes medications, particularly metformin, can interfere with the absorption of crucial vitamins like B12 and B1. So, while your medication is doing its job to help control your blood sugar, it might inadvertently be creating other deficiencies that lead to new symptoms. Thirdly, older age often means less efficient digestion and absorption of nutrients, making it even harder for the body to get enough from a diet alone, even a healthy one. These vitamins aren't just nice-to-haves. They're crucial cofactors for thousands of bodily functions, from nerve repair and protecting your blood vessels to energy production, and even mood regulation. When they're missing or in short supply, symptoms emerge, often mimicking or worsening existing diabetic complications. Now, crucial disclaimer. Please understand that the information shared today is not a substitute for your doctor's advice. These vitamins are powerful tools to support your overall health strategy, not to replace your prescribed medications or treatment plan. My strongest advice is to print out this list and discuss it with your healthcare provider. Ask them about getting your vitamin levels checked, especially B12, B6, and folate, because knowing your current status is the first step towards personalized, effective support. Vitamin number 1, benfotiamine, the nerve shield. Let's start with a silent thief that often robs diabetics of their comfort. Nerve pain, tingling, and numbness, what doctors call diabetic neuropathy. Do your feet feel like they're burning, or have that pins and needles sensation? Benfotiamine might be your answer. Benfotiamine is a fat-soluble form of vitamin B1, unlike the common water-soluble thiamine. Think of it this way. Thiamine is like trying to put out a fire with a bucket of water that evaporates quickly. Benfotiamine is like a high-pressure hose that gets right to the source of the flame and penetrates deeper. Its fat-soluble nature allows it to be absorbed much more efficiently and reach your cells in higher concentrations. Its magic lies in how it helps your body process sugar. When blood sugar levels are consistently high, It creates harmful compounds called AGEs, advanced glycation end products. These AGEs are like sticky sludge that damage nerves, blood vessels, and tissues throughout your body. Benfotiamine helps redirect excess sugar away from these damaging pathways, essentially protecting your cells and nerves from this sludge buildup, mitigating the formation of AGEs. This protection is vital for preserving nerve function and preventing further damage. Imagine Mr. George, 68, who couldn't enjoy his evening walks due to excruciating foot pain and persistent numbness. He felt trapped and frustrated by the limitations of his neuropathy. After discussing with his doctor and adding benfotiamine to his regimen, within a few weeks, he started walking further, sleeping better without the constant burning sensation, and finally felt like he was getting his life back. This is the kind of tangible improvement benfotiamine can offer. Numerous studies have shown benfotiamine can significantly reduce pain, burning, and numbness associated with diabetic neuropathy. It's been observed to improve nerve conduction velocity, how fast signals travel along your nerves, and even increase blood flow to the limbs, which is crucial for nerve health and healing. Typical dosage for benfotiamine is 300 to 600 milligrams per day, ideally taken with food for optimal absorption. It is generally very safe with minimal side effects reported. While individual results vary, improvements usually appear within a few weeks to 2 to 3 months of consistent use. If you're on metformin, this is especially important to note, as metformin can deplete B1. Supplementing with benfotiamine can help counteract this potential deficiency. Furthermore, benfotiamine also pairs wonderfully with alpha-lipoic acid, ALA, a common European combination for enhanced nerve health support. This synergy can offer even greater benefits for nerve protection and regeneration. Vitamin number 2, Methylcobalamin, the brain booster and nerve repairman. Have you noticed your memory isn't as sharp as it used to be? Are you constantly battling brain fog or feeling a profound lack of energy even after a full night's rest? For many diabetics, especially those on metformin, the culprit could be a deficiency in vitamin B12, specifically the right form. We're talking about methylcobalamin, the active, natural form of B12. This is critically different from cyanocobalamin, the more common synthetic form found in many standard supplements. Cyanocobalamin requires your body to convert it into its active forms methylcobalamin and adenosylcobalamin, and many diabetics and a significant portion of the general population struggle with this conversion process. Methylcobalamin, on the other hand, is like a pre-cooked meal ready for immediate use by your cells. This is crucial if you have genetic variations like MTHFR or simply reduced metabolic capacity due to aging or chronic illness. Think of your nerves as electrical wires. Myelin is the protective insulation around them, allowing signals to travel fast and smoothly. Methylcobalamin is absolutely essential for repairing and maintaining this myelin sheath, which can be damaged by high blood sugar and inflammation in diabetes. When this insulation is compromised, nerve signals can slow down or misfire, leading to neuropathy symptoms. Beyond nerve repair, methylcobalamin also plays a vital role in reducing homocysteine, an amino acid that, when elevated, can harm your blood vessels and brain, contributing to cognitive decline and cardiovascular risk. Let me share a hypothetical example. Mrs. Alice, 72, shared that she felt sleepy and drained even after a full night's rest and often found herself forgetting why she walked into a room or struggling to find the right words. These cognitive and energy issues significantly impacted her quality of life. After her doctor, recognizing the signs of potential B12 deficiency, especially given her metformin use, recommended methylcobalamin, she remarked, "It feels like a light switch has been flipped on in my brain. My energy is back and I feel so much clearer." Beyond nerve repair, methylcobalamin is vital for healthy red blood cell formation, which is crucial for combating fatigue and ensuring oxygen delivery throughout your body. It also contributes to the production of key brain chemicals that regulate mood and energy, such as serotonin and dopamine. Many patients report improved focus, better sleep quality, and a brighter, more stable outlook. Typical doses range from 1,000 to 5,000 micrograms daily. For better absorption, sublingual tablets, dissolved under the tongue, are often preferred, especially for those with digestive issues or compromised stomach acid. It's safe, water-soluble, and any excess is simply excreted by the body, making it a very well-tolerated supplement. The importance of methylcobalamin is paramount if you are taking metformin. For those on metformin, supplementing with B12 isn't just a recommendation, it's a strategic defense against potential deficiency, as metformin is known to impair B12 absorption. Ask your doctor about testing your B12 levels regularly to monitor and address any potential shortages proactively. Vitamin number 3. Pyridoxal 5-phosphate P5P, the mood and metabolism stabilizer. Do you find yourself more irritable than usual? Is getting a good night's sleep a constant struggle, leaving you feeling unrest and on edge? Or perhaps you're just not feeling as sharp and mentally resilient as you used to. Your vitamin B6 might be struggling to keep up. We're talking about Pyridoxal 5-phosphate or P5P, the active form of vitamin B6. This is not the common pyridoxine found in many generic supplements. And this distinction is vital. As we age, or with conditions like diabetes, our liver's ability to convert pyridoxine into its active form, P5P, can be significantly impaired. Taking the wrong form, especially in high doses, can actually be counterproductive and even harmful to your nerves, potentially leading to peripheral neuropathy. P5P bypasses this conversion step, providing your body with the direct, usable form it needs for its numerous critical functions. P5P is a master orchestrator involved in over 100 enzyme reactions throughout your body. It's crucial for synthesizing neurotransmitters like serotonin, often called your happy chemical, dopamine, important for motivation and pleasure, and GABA, a calming neurotransmitter. This means adequate P5P levels can translate to better mood regulation, improved sleep quality, and a greater sense of calmness and well-being. It also works in a powerful synergy with B12 and folate to break down that harmful homocysteine we discussed earlier, further protecting your cardiovascular and neurological health. Interestingly, P5P levels are often lower in individuals with diabetes. This can be partly because high blood sugar can inhibit the enzymes needed for its conversion into the active form, and it can also lead to increased loss of P5P through urine. Research also suggests a link between B6 deficiency and insulin resistance, meaning adequate P5P levels might help your cells hear insulin's message better, potentially leading to improved blood sugar control. P5P works beautifully with magnesium, often called nature's relaxant, to support optimal nerve and muscle function, further aiding in relaxation and sleep. Typical dosage for P5P is 25 to 50 milligrams daily, but higher doses, such as 100 milligrams, might be recommended by your doctor for severe deficiencies or specific nerve issues. Always take with food for best absorption. Vitamin number 4. L-Methylfolate, the DNA protector and mood enhancer. Do you ever feel a persistent sense of sadness, anxiety, or a lack of motivation without a clear reason? Or perhaps you're struggling with focusing, experiencing memory lapses, and feeling consistently drained of energy? The answer might lie in a crucial B vitamin that many of us simply aren't utilizing correctly. Meet L-Methylfolate, the active form of vitamin B9. This is not the synthetic folic acid found in many processed foods and standard supplements. This distinction is critical. Folic acid is like a raw ingredient. Your body needs to cook it into L-Methylfolate to use it effectively. The problem? A significant portion of the population, an estimated 40 to 60%, has a common genetic variation called MTHFR, which makes this cooking or conversion process incredibly inefficient. If you have this MTHFR blueprint hiccup, taking regular folic acid might not only be ineffective, as your body struggles to convert it into its usable form, but could potentially be counterproductive, leading to unmetabolized folic acid accumulation. L-Methylfolate bypasses this conversion step entirely, giving your body the direct, usable form it needs, making it bioavailable immediately. L-Methylfolate is a cornerstone of the methylation cycle, a vital bodily process involved in everything from detoxification to controlling inflammation and, crucially, repairing your DNA and supporting gene expression. It also works hand in hand with B6, P5P, and B12, Methylcobalamin, to effectively lower homocysteine levels and produce those essential brain chemicals like serotonin, dopamine, and norepinephrine, which profoundly impact your mood, sleep quality, and overall mental clarity and energy. For diabetics, L-Methylfolate contributes to nerve healing and regeneration, working synergistically with the other B vitamins we've discussed to support overall neurological health. Furthermore, L-Methylfolate has been linked to improved insulin sensitivity. When your cells are listening better to insulin signals, your blood sugar control can improve, contributing to better long-term outcomes for diabetes management. Doses typically range from 400 to 1,000 micrograms daily, or higher if recommended by your doctor, especially if you have a known MTHFR mutation or a confirmed deficiency. It's generally well tolerated, but starting with a lower dose and gradually increasing is always wise to assess individual tolerance. If any of these mood, energy, or cognitive symptoms resonate with you, consider talking to your doctor about testing for MTHFR variations and your folate levels. This small insight could unlock big changes in your energy, mood, and overall diabetic health management. Important considerations and next steps for your health journey. So, to recap, we've explored 4 powerhouse vitamins that hold immense potential for individuals managing diabetes. Benfotiamine, for powerful nerve protection and soothing neuropathy symptoms. Methylcobalamin, for brain clarity, boosted energy, and essential nerve repair. It is especially crucial if you're on metformin. P5P, Pyridoxal 5-foot, Phosphate for mood stability, improved sleep, and metabolic balance. L-Methylfolate, for DNA protection, enhanced mood, and supporting healthy methylation. Remember, while these vitamins offer incredible potential for supporting your health, everyone's body is different. What works perfectly for one person might need adjustment for another. That's why consulting your doctor is absolutely paramount. They can help you determine your specific deficiencies through blood tests and guide you on appropriate dosages and the most effective forms for your individual needs. It's also crucial to consider the quality of the supplements you choose. Not all supplements are created equal. Look for reputable brands that provide third-party testing to ensure purity, potency, and that the product contains what it claims. And always discuss any new supplements with your doctor, especially if you're on other medications, to avoid potential interactions or contraindications. These vitamins are powerful allies, but they work best as part of a comprehensive, holistic approach to diabetes management, alongside a balanced, nutrient-dense diet, regular physical activity, effective stress management techniques, and adherence to your prescribed medications. They are designed to support and enhance your overall health strategy, not to replace any existing treatments. Don't let diabetic complications steal your quality of life any longer. You have the power to take active, informed steps towards better health and greater well-being. Take this video, or better yet, print out this list of vitamins and have an informed conversation with your doctor at your next appointment. Ask them if these essential vitamins could be the missing link in your journey to feeling better, more energetic, and more in control of your health. Final conclusion: reclaim your vitality. Imagine waking up feeling more energized, your mind clearer, and those nagging nerve pains finally fading into the background. This isn't just about managing a condition, it's about reclaiming your vitality, your independence, and your ability to truly enjoy life with your loved ones, to engage in activities you cherish, and to feel vibrant again. By understanding and potentially supplementing with these 4 essential vitamins, you're not just a patient, you're an empowered advocate for your own health. You're giving your body the precise tools it needs to heal, to thrive, and to resist the challenging complications of diabetes. If this video resonated with you, if it gave you hope or answered a question, please give it a thumbs up. Your likes help us reach more people who desperately need this vital, empowering information. Subscribe to our channel for more science-backed health insights delivered straight to you every week. And don't forget to share this video with anyone living with diabetes who could benefit from this knowledge, helping them to potentially transform their daily well-being. We want to hear from you. Comment below with your questions, your experiences with these vitamins, or what other health topics you'd like us to cover next. Your feedback helps us create content that truly serves you and our community. Thank you for watching. Remember, small, informed steps can lead to monumental improvements in your health journey. Take that step today. See you in the next video.